It always seems that the dental hygiene students get confused on where they sit. That is in relation to the patient. We refer to this as clock position using the hours as reference. This video will refer to a right-handed hygienist. They use 8 o'clock to 12 o'clock. Left-handed hygienists used 4 o'clock to 12 o'clock. So what teeth do I work on when sitting at 8 o'clock? Or 9 o'clock is shown in this diagram, or 9 o'clock is shown in this diagram. It is a personal preference as long as your torso is perpendicular to the long axis of the patient. And what teeth do I work on for my 10 to 11 o'clock position? And in this position, the operator is sitting at 12 o'clock. What teeth do I work on from sitting at this position? The operator also has an advantage where the patient's head can turn from side to side. This will assist us so we can sit ergonomically correct. Let's now look at the anterior surfaces towards us. In this position, we will sit at 11 o'clock. The patient's head is tilted back slightly and their head can rotate either towards us or away from us. This position is for facial and lingual aspects of the maxillary anterior. Here we have mandibular surfaces towards the operator. For this area of the teeth, we will sit at 8 o'clock. The patient's chin is tilted down. The patient's head can move side to side. This position is for facial and lingual. Now let's take a look at the anterior surfaces away, maxillary and mandibular. For the maxillary, we will sit from 11 to 12 o'clock and could possibly move to 1 o'clock if needed. The patient's head is tilted back. The patient can move their head from side to side. This position will allow us to access these anterior teeth facially and lingually. Now for the mandibular anterior teeth surfaces away from the operator. The operator will sit from 11 to 12 o'clock and towards 1 o'clock if needed. The patient's chin is tilted down. Their head can rotate side to side. This position will allow for the operator to sit ergonomically correct for the lower mandibular anterior teeth surfaces away. As we move to the posterior teeth, we will separate the right from the left side. A little hint here: when using the instruments in the posterior, the end you will use for surfaces towards on the right side is the same end you will use for the surfaces towards on the left side. 9 o'clock is the position that the operator will set for the maxillary posterior surfaces towards you. You will ask the patient to tilt their head slightly back and slightly towards you. This is the position for the maxillary surfaces towards the operator. We will also sit at 9 o'clock for the mandibular posterior surfaces towards you. You will ask the patient to tilt their head slightly down. And you will also ask the patient to turn their head slightly towards you. It is very important to ask the patient to move their head for you. Do not try to move it for them. This is the position for mandibular surfaces towards the operator. Let's move to the surfaces away from you. Do you remember the tip I gave you a few slides back? When using instruments, the end that you use on the left side for surfaces away from you is the same that you will use for surfaces away on the lingual right. The operator sits at a 10 to 11 o'clock position. The patient's head is slightly tilted back and slightly away from the operator. As for the mandibular surfaces away, the operator will sit at a 10 to 11 o'clock and the patient's head is tilted slightly down and away.